So while we're still above the neck, my buddy here's having a knuckle sandwich right now, and it's really obvious that he's very turned on in a good way. He's very happy, and he's just loving my knuckle. And this kind of points out one thing. When babies are happy, they drool like crazy. They just spill out like they need a little drool bucket underneath their chin. Like that old Saturday Night Live skit from years and years and years ago. And the thing is, the tone in the mouth is not very high. And so when babies make a lot of saliva, they can't hold it back in their mouths very easily. So when they're really happy, sometimes they just gush a lot of saliva. And it doesn't mean that they have a sore throat or any kind of pathology in their mouth. It just means that we're just making their life a joy.
Oh, good.
And so the more they chew on knuckles and other things too, that brings on a lot of salivation as well. So not to worry, just keep a drool cloth around and chill out and just enjoy the fact that you're making your baby happy. Now, a couple more things about your neck, and these are things that generally will alarm parents, but they're actually normal. So we should talk about them because these are things you're going to feel a lot the first 2-3 years of your baby's life. Behind the neck and behind the ears and coming all the way around underneath the chin are sort of a fishnet of what are called lymph nodes. And these are tiny little lentil-sized organs in our body that cleanse and protect us, and they also enlarge to protect us during colds, when there are rashes on the head, when there are scratches or trauma on the face. And often, if children are even exposed to viruses, or sometimes even after vaccines, these lymph nodes may feel like peas or corn or succotash or little lima beans, exactly. And there's a whole network of them behind the neck. And because the skin is so thin there, and because there's very little hair to cover that area, it really sets off alarms in parents. So as long as he is happy and he doesn't have fever and he's not showing any signs of distress, you're going to feel those little peas and carrots probably for the greater part of the first 3 years. And in the front as well, say if he's cutting a tooth, or if he's got a sore throat, or he cuts his lip, you may see or feel some enlargement of these glands either underneath the chin or on the neck as well. And again, that's just nature and his immune system really protecting him and straining out any bugs that might be making their way into his body. So we look at that as actually a bonus, a plus, not a negative. Back to your neck, the other thing too is that although we really can't see or feel the thyroid gland, which is the body's orchestra conductor of hormones, it lives right here at the base of the neck, there are rare occasions in which we may see the thyroid enlarge in babies or in toddlers. And so it's good for parents to lift their baby's chin, sort of get a feel for what is normal, so that if something does change, much like a breast self-exam, you're going to be the first person to know that. And especially because the neck is under wraps, it's important to kind of lift it up, a couple times a week and really take a good look and make sure you know what's normal for your baby. So that does it for above the neck. So now, Luca, we're going to talk about you between the neck and down to your shorts, all right? So one of the things that we notice about little babies who are 4 to 6 months of age is that they have a lot of body fat in their central body, and it makes them, again, luscious and Buddha-like, and so we just want to squeeze them and love them and blow farts on your tummy, which I'm sure your parents do on a regular basis. But also there's a lot of what's called subcutaneous or under the skin fat that happens under the nipples too, even in baby boys. So they look like they could wear an A cup for the better part of the first year. And then as they get thinner and more mobile, that goes away. But don't be alarmed if it looks like his nipples are a little bit more prominent or sticking up with a little breast tissue underneath. With girls, the same thing happens too. And a common question that parents ask is about the nipples, especially in girls for whatever reason. If they look inverted from birth, oh, how are they going to nurse? What's going to happen to them later in life? Well, those are temporary situations. The tissue is just tethered down inside temporarily, and as puberty and adolescence happen, then the nipples generally will pop up and stand at attention. So we don't have to worry or obsess about those things. With his chest, one of the things that you noticed, and we talked about before, was that his breathing is more rhythmic and it's actually slower as well. But as he becomes more active and as he becomes more playful with you and bouncing up and down in your arms, if he gets really excited and he's gushing out a lot of saliva, he may have to stop and cough because he's got so much saliva dripping in the back that he's got to take a pause and clear his throat. So Babies who get older and as they start crawling and as they start walking around will cough periodically just like we do, but because they live in a fishbowl and we're watching every little move they make, we need to interpret those coughs as just a clearing mechanism. If coughs are constant because they're due to colds or due to illnesses, then that usually is accompanied with a baby who's unhappy. But if he's periodically having a wet cough, it just means that he's clearing something from his airway, typically mucus, because you're happy. All right? Yes. Good. And chest walls in babies are still fairly thin in the first year of life and even thinner in the second year of life. So we can see our baby's ribs pretty easily. And so when they take a breath in, if we see the outline or contour of the ribs, we don't really have to worry about that. But if their breathing is fast or labored, or if there's an issue with the breathing sounding abnormal, then we look at the ribs a whole different way. If the skin is sucking in between the ribs with an illness, then we worry that there may be a little extra work of breathing. But right now, we see those ribs for what they are. They're just a protective mechanism for his lungs and for his chest. And we can actually put our fingers around him and kind of put our fingers between his ribs and know that they're just moving in a nice, easy way. The other thing that we can feel pretty easily because his chest wall is so thin is his what's called cardiac impulse. That if you have your fingers just exactly on the right part of his chest, you can feel his heartbeat underneath there. And if he's excited, if he's all jacked up, his heart rate's gonna go up. Just like if we're at the gym or we're excited, our heart rate goes up. And if he's asleep, if you have your hand on his chest, you're gonna feel that the heart rate goes down. Now the heart rate does change dramatically in these first 2 years. So whereas we feel a heart rate in a baby of 100 to 140 beats a minute, by the time they're a year of age, it's closer to 100 beats per minute, and by 2, it's closer to 80 to 100 beats per minute, much like ours. So the cardiac rate or the heart rate does come down as his body gets bigger. He's got more veins, more arteries to kind of accommodate all the blood flow. But right now, the heart rate still is fairly rapid in his age group, and if he has a fever, or if he's excited, or he's all jacked up, you're going to feel that it's really boom, 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 boom. But again, if a happy baby is going along with that accelerated heartbeat, we don't have to worry about that. In another segment, we'll talk about when to worry about it. But for now, your heart rate is just fine, my buddy. It is. All right. Well, since you're sitting there so Buddha-like, we'll talk about your tummy right now, too, because the Buddha tummy, or the protuberant tummy, that is not associated with pregnancy, but just being a baby, happens because the abdominal muscles on this region of the body are kind of like tissue paper when babies are born. So they really can't hold in all the contents of those many, many feet of intestines you have. But as you start to bear weight, whether mom's holding you on her lap or as you start to learn to sit and these abs start to get stronger, then we won't see the baby's tummy be as protuberant unless he's trying to bear down and have a poop, or if he's had a big meal, if he's got some gas, he's going to look like a Buddha, and then after he takes a poop, he's going to deflate a little bit. Yes. Once babies are crawling, they really start to build those abs because they've got to hold them against gravity, and once they're upright, then they develop their little six-packs. But again, if they're really relaxed, they're chilling, they're not very excited about anything, they let it all hang out too. So your 1-year-old or your 2-year-old may look periodically like a Buddha and even stand with their booty out, and it accentuates the protuberance, but that's usually in the relaxed state. So those are all norms, ranges of norm. You can have babies who are 1 or 2 that look like they're in a Mr. America contest with a 12-pack, and you can have others that look like they're 6 months pregnant and they're all normal as long as they're comfortable, growing, and thriving. But for now, yours is absolutely irresistible. Now, belly buttons are usually not a big concern at this age because obviously the cord has fallen off, but they can accumulate dirt and dust and little dust bunnies, so it's important to get in there with a Q-tip and keep them clean. But they are also a source of spontaneous hernias in this first year or 2. So if a baby is born without any separation of the muscles here, but over time as they start to stand or have some hard poops or bear weight or just genetically have a predisposition to hernias, occasionally we'll have a surprise where all of a sudden there's this bulbous kind of soft, squishy, noisy little protuberance around the belly button, and that means that a hernia has sprouted. It can also happen under your diaper drawers too. So with boys, inguinal hernias occur. They occur in the pathway where the testicles take their journey down to the scrotum, and if that little security band there opens up, which it shouldn't, but it does on occasion, we may see all of a sudden this acute swelling of one side of the scrotum in a baby. And if that swelling comes and goes, we know that a hernia has probably occurred in the groin or inguinal area, and those are definitely reasons to talk to your doctor.